at the end of the round table. I would like to invite Dr. Anmol Chugh, who's an aesthetic plastic surgeon based in Delhi, New Delhi. He has done his aesthetic surgery training in Australia. He's worked with Graham Southwick and Brian Mandelson, and he has done a lot of research in Nanofat for scars. And notably, he's the chief editor of the popular plastic surgery magazine, PLASTICOS. So with that, I would like to invite Anmol, and this is to hear his views on how he goes about doing the Nanofat and whether it's different from what Dr. Steve Cohen does.
Thank you, respected chairpersons. I'm very thankful to IMCAS and IAPS for providing this wonderful opportunity to be part of this esteemed panel. I'm a huge fan of Dr. Steve Cohen's work and also his artwork, and his presentation was absolutely excellent. So my 2 cents in this is basically the approach. So the paradigm shift came with the concept that you should treat adipose tissue like a parenchyme and mesenchyme. The parenchyme being the adipose part and the mesenchyme the SVF part. That is what we are targeting, as illustrated by Dr. Stephen Cohen, that illustrates that Nanofat is basically SVF. So what we get into this is how you prepare the fat. That is very important, that right from the harvesting part, how you prepare that. So my methodology is a bit like Dr. Tonard and Verpele, as he described in 2013, and which further modified also by using 2 filters, 2.4 and 1.2 lower law connectors. So my technique is based on that. But first part that I want to emphasize is the technique to harvest. Like I use a sharp cannula instead of a barbed one, that too of a 2.5 millimeter, 2.4 millimeter with 1 millimeter holes, multiple holes. So it has been shown in multiple studies also, the amount of adipocyte stem cells is much more in the sharp cannulas than the barbed ones. That is one important point that I feel that it should be considered. Second is the technique. I use vacuum aspirated. I think people use power assisted tools. People have used lasers and also, but I feel still the ultrasonic and all I have used only vacuum. So my studies have been based on the vacuum thing. Now the next thing is the processing part. The processing, I believe that in Dr. Cohen's studies also that I have read that whether do you do centrifugation, whether do you do rinsing, all are same. The important part is to rinse the fat. The rinsing is important because the tumescent solution that has to get out. Otherwise, it affects the adipocyte cell lineage. It breaks the fat cells. So that is the rinsing is an important part that I feel that it should be considered. Now, next point is that I would like to make is the fat graft, how to make nanofat. There are various techniques, like there's lipogems, there is lipocube, as Dr. Cohen, Dr. Teriyaki has described. There is multiple techniques out there. What I practice is somewhat modification of Dr. Tonard. So I use 2.5, 2.4 and 1.2 millimeter low lock connectors. And there is a bit of difference with the filter. I don't use the tulip technology, but I have got this Indian, basically what you call jugaad, or the cheaper version of a well thing. This is a sieve. This I use both for making my tea and my nanofat. So this has helped me, at least the particle size is 0.5, it's 0.4 to 0.6 millimeter. So I feel that the filter, can be used like this. You can use your nylon sheet that has been originally used by Dr. Tonard. So that factor, I think that makes a difference. 19 that was published in PRS Global Open, that was by Sese et al. And they emphasize on the fact the constitutive cell dose. And the good thing is that was higher if you take it out in the mechanical disintegration of the stem cells rather than enzyme, which has been traditionally considered as a gold standard. So that's a good part. Even if we're using different techniques of mechanical disintegration of fat into SVF, the total load, this SVF, is higher than what you get in the enzymatic method. So that is one important point. So another part, the concept is the constitutive cell dose. It is something like what you give in the cancer patient. You give the radioactivity dose. It's something like that. The amount of dose that will require is sort of fixed. A tissue repair, for the tissue repair, is sort of fixed. So that is very important. The constitutive cell dose, that is also much higher if you do it in a mechanical disintegration. You can use it various techniques. The authors have published by using the Dr. Tonar's technique, but I'm sure that the evaluation of the results and all that will be different by different techniques. And another point that I would like to make is I think the viability also depends on the lower lock connectors. Like I give 30 pushes from each of the 2.4 and 1.2. So it has been seen that the mechanical stress, the more the mechanical stress, the more the SVF amount is released. So I think that is very important. Rather than the filtering part, the emulsification part, the disintegration part is much more important. And even if I think you don't filter, if you can make sufficient amount of that whitish fluid with 2.4 and 1.2 by multiple passes, I think that's also fine and can be a subject of research, considering that it doesn't involve any, investment or some kind of difficult device or some kind of expensive device. So my view is basically that we have multiple methods, and my work has been extensively in the scars. What I have seen, what I have done is through this method only, sieve method, that is what I call. And I have seen some significant results in the pigmentation part and the pliability, because in the Indian skin especially, scar is very painful. I mean, in the sense that it doesn't go away by the scar revision, like it doesn't heal like in the Caucasian skin. So we have to be very careful in what modality we use. So it has proved to be Nanofat has proved to be a boon in many of the patients, especially for the scars, because it has improved the pigmentation, not at the earliest part, but it takes 6 to 9 months, maybe 2 or 3 sessions in some patients. Also, the pliability factor has also been affected. So I believe there are various techniques of how to make Nanofat. I mean, I have done lipogems when I was with Dr. Mendelsohn. He uses lipogems quite frequently and is quite fond of that. And the procedure also is there, the mechanic is there. Basically, the emphasis is on the part that mechanical disintegration. That way is in a good, because you don't have to depend on the enzyme, which is, I think, has an ethical problem in most of the countries. And second part is also the collagenase enzyme that comes is from the Clostridium, and some xenogenic properties of the compound that can also be problematic for the patient. So the important part is to consider many different techniques, but emphasize on the mechanical disintegration. Secondly, also we have to consider the BMI of the patients, the fibrosis, amount of fibrosis and all that stuff. So that is also needs to be considered while we are evaluating multiple results. How is the bed? How is the vascular bed? Because ultimately it's like any other graft. The take and all that depends on how is the bed, how you're injecting. So there are multiple factors involved, starting from the cannula, how you extract, how you filter, and how you inject. So multiple processes are there, and I think there's a lot of scope for every device. Yeah, thank you.
Very interesting perspective and viewpoint, Anmol. I would like to ask Katrina to invite our next speaker so that we can move on with this session.